Silly hair? Don't care. I'm Dustin McDallas and I'm a nurse practitioner in Florida. I have a background of 5 years in neurosurgery and neurology, and I currently work in substance use disorders. And as a psych nurse practitioner, medical nurse practitioner, I'm here to talk about pain today because there is a cold front coming. And I'll tell you guys what, I have arthritis, both of my shoulders. I've torn this a couple of times. I've had a labrum tear over here, biceps tendonitis. My goodness, golfer elbow, tennis elbow, biceps tendonitis. My senior year of high school, that was when I decided to retire from tennis because of the injuries that I'd gotten. I made it through state championships and all that stuff, but I was like, this is not worth it. Unfortunately, now that I'm 35, compared to when I was 18 years old, when the weather comes, I could feel it. I mean, the cold front is slowly coming in through now, and there's a little bit of rain, but I was just on the computer and you just start to this shoulder, it's starting to kind of, there's a sharp pain that goes in, and there's pressure buildup. A lot of times with polyarthritis or just general history of just injuries, people feel weather. And I broke my arm in 1999. For 3 years, my left arm, I broke my humerus and my wrist at the same time. And it was from a fall with me playing with my friends, and it was just a bad break. I had pins in it. I was feeling the weather come in, or even when it rains, because we moved to Florida right after I broke it. It's pretty terrible. It almost feels like somebody's trying to blow up a pressure bag inside from your bone, but inside. So the pressure is there. It's not like sharp pain. Sometimes it can be sharp pain, but it's more like dull, progressing pressure, deep pain. So that's what arthritis feels like. So because there's a cold front coming, I'm actually pre-medicating myself. So I'm taking 600 milligrams ibuprofen. I already took my muscle relaxer. I take tizanidine, 2 milligrams in the daytime, 4 milligrams at nighttime. But yeah, I'm gonna be getting some moves today. Moves? I'm gonna be moving today, physically, just to kind of stay ahead of it, do some yoga later on, or some Pilates. But that's what helps me. There is also this TENS unit that I have on my table, and I talk to my patients about it quite a lot. A TENS unit is nowadays they're only $30-something on Amazon. Back then, when technology wasn't here, they used to be as big as a desk, and they used to be in the thousands of dollars. But now it's $30, and they're the electrodes that go on your muscles. I usually put it in the front, in the back, here, and another one over here. So it has to crisscross applesauce the joint with the electrodes, so that helps. I also have a bunch of these that kind of help support me. Warm packs that I bought on Amazon that goes on your t-shirt, not on your skin, and they work really well. And they honestly, the box that comes with it's pretty big, so they last me a good year. And whenever you open it, when it gets exposed to air, it starts to warm up, and it lasts for 18 hours. No, it says 12 hours, I'm sorry. When it's really bad, I might have to put that on tonight, especially if I'm walking around outside. I usually put it on a jacket, in my jacket, and then put it on and off. Or if I have one of my undershirts, I put it on my undershirt. So those are the pain, arthritis things that I do. I love educating people about the alternatives that you could do for pain, because not everything is medicine. There are times when obviously the medicine is needed, especially in acute pain. But when it's just general, discomfort, muscle tightness, and it really also depends on the pain too, because you have sharp stabbing, shooting, aching, burning, right? Burning pain is more neurological, nerve pain, aching, arthritis, pressure, what have you. Burning, depending on how hot the shoulder is as well. You have to palpate the shoulder, see if it's hot, if it's swollen. Where's the pain from 0 to 10? That's the basic question, right? 0 to 10, where's the pain location? Onset duration, when did it start? Yesterday. When did it start? Oh, it started in high school when I was a tennis player. precipitating factors. Oh, the cold front's coming, so my pain is coming in. Relieving factors, right? We've got heat packs, ibuprofen. Timing. When does the timing come? Is it worse in the morning? It's worse in the morning for me because I sleep on my side sometimes when I notice it. So timing, it's usually bad in the morning. So those are things that helps you focus in and hone in on your patient's complaints, and you can treat it properly. Because if you just ask them 0 to 10 pain and the location, okay, cool. Quality assessment care is like, even with nerve pain, like you have to ask your patients, like, does it radiate to your fingers? Does it radiate up here to your neck, or does it shoot up? With nerve pain, with cervical spine, you've got cervical C5, C6, C7, all the way to the pinky. So when people have like pain on the thumb, it's usually like C6, so the location. You test their head like this, you hold it on, and they start to have numbness, tingling, then it's probably an impingement. So yeah, assessment questions. I guess I decided to just make a video out of my pain. So enjoy your Saturday, stay warm, Florida. Oh, and if you enjoy these little snippets of videos, I know it's kind of silly, but like and subscribe, comment down below for any questions or video requests.